Hello and welcome to Vriddhi Health. In this podcast, we'll be talking about mental health issues through the lens of science, compassion, and clinical insight. I'm Dr. Pavitra Shankar, and today we are going to dive into a topic that affects millions, but it is still widely misunderstood. Substance dependence, addiction, abuse, these are words that we throw around interchangeably. But what do they actually mean? How does someone go from casual use to losing control, and what's really happening in the brain during all of this? Whether you're a healthcare professional, someone who's struggling with substance abuse, or just curious, this episode is for you. Let's break down what substance dependence really is, how it develops, and why it's simply not just a matter of willpower. Let's start with some clarity. When we talk about substance and substance related issues, the terminology can be confusing and language really matters here. So, when we talk about substance use, it just means that someone is using a substance like alcohol, tobacco, cannabis, or a prescription medication like Xanax. This alone doesn't mean that there's a problem. But misuse or abuse, where they are being used in a harmful way or a risky way, that's where problems begin. So, someone who is using these beyond a certain limit and is causing problems in their life, that's what we would consider as abuse. And dependence, here is where things get really serious. And this is a state where one's body has adapted to a substance, and you need it more. You need like higher doses to get the same amount of effect. So there's tolerance. There are some withdrawal symptoms, and so think of dependence as the body saying suddenly I've got used to this and don't take it away from me. And addiction is not a scientific term, but we often call this as substance use disorders in psychiatry, where there are a number of symptoms which we'll be talking about later on, and it's a more severe form of it's another way of saying that the dependence really is hampering one's life. In short, independence, one person would be, using more than intended, would be struggling to stop. Their whole life would start revolving around substance use. So while dependence is about biology, addiction includes a broader picture where we look into behavioral changes, psychological, social factors, and when someone uses substances like alcohol, opioids, stimulants, they trigger a flood of dopamine in the brain's reward centers, the nucleus accumbens and related pathways. And this causes the high experience, and it causes what we call an intense pleasure and the initial high that one experiences on the first use. But the brain slowly adapts. So, tolerance develops, and repeated use dulls the dopamine response, and thus the brain starts to require more of the substance to have the similar effects. Use stops, the brain struggles, and dopamine is low, and the cortisol levels and stress symptoms have ramped up, and withdrawal symptoms have set in, like anxiety, irritability, sleep issues, physical discomfort. And on top of this area in the brain called as the prefrontal cortex, or what is also required for our decision making and self control, that becomes compromised with chronic use. So that's why it gets so hard to stop even if someone wants to. So the brain resets and starts to need more drugs to feel good, and without the drug it starts to feel awful, and the self control systems, the PFC, is totally eroded, and it goes to a level beyond willpower because now biology is at play. So we can look at this as a three-step addiction cycle where addiction unfolds through a repeated cycle. And those three stages sort of reinforce on each other. So in the first phase, which we call the binge and intoxication phase, it feels like a rush or a pleasure when that's when the first time you use the substance. And what's happening in the brain right at that time is the dopamine surges in the reward circuits, and they strengthen it strengthens what we call habit formation. Over time this becomes sort of an automatic behavior, especially with repeated uses of substances and your body getting used to it. And it's that initial thrill when the brain's pleasure circuits light up and you feel amazing, And with repetition, your brain starts wiring this behavior into a habit. The next is the withdrawal or the negative affect stage or the negative mood stage, where it feels like the opposite of that high, where there's irritability, there's anxiety, there's depression, restlessness, and sometimes physical symptoms. And here is when there is reduced dopamine levels, plus there is activation of the stress centers like the amygdala, there's increased cortisol. And the brain shifts from a reward stage to sort of just avoiding pain. So if it's when you don't use or you don't abuse and suddenly you just feel awful and your brain is just low on the feel good chemicals and it's overloaded with the stress signals. And the third is the preoccupation or the grieving or anticipation phase, which feels like constantly thinking about the next use, craving, planning, seeking, going out of your way to consume or buy substance. Here, this happens because, as we talked about, the prefrontal cortex, the one that is used for decision making and your control, it has been hijacked by the substance that you've used earlier multiple times. It's like your brain, it switches to overdrive mode, and every thought, every craving, it's about getting the next dose, planning, scheming. That's the cycle's final and most dangerous phase. And why this cycle keeps on going is because each time someone moves through these stages, binge, withdrawal, craving, the brain rewires more deeply. Pleasure fades, pain and avoidance dominate, and craving intensifies. It's not a straight path, it's a loop that reinforces itself eventually over and over again. So it could be like you picture a hamster wheel in the brain. First comes the rush from the first cigarette or drink, then the crash when you stop and suddenly you're feeling off, and next is the obsession. I need it and I have to get it. And round it goes. Each time through, this loop spins a little faster and making escape harder. Now let's move from the biology to the behavior. What we see on the outside and what someone feels on the inside. So substance dependence isn't just about the brain or the chemicals. It's also about how we feel or how people think and behave over time, and how they feel on these substances and of these substances. And this is where addiction gets really complex and human. So here are some key psychological features we often see in patients or people who have substance dependence. So there would be sort of an impaired control where a person uses more of the substance or for longer than they had initially intended. So you thought of just taking one drink, but then you ended up countless drinks later, not knowing where and how that happened. They might say, I ended up drinking the whole bottle, or you thought that you'll just drink on a trip, but then you've been drinking even 6 months later. And they may try to stop and genuinely want to stop, but people are not able to. And this leads to a sense of frustration, guilt, and a deep sense of helplessness. And then there's craving, which is not just wanting a substance. It can feel like an overwhelming sort of desire when the brain is sort of screaming for it. And sometimes the craving is triggered by a feeling like stress, feeling sad, or feeling, or let's say a place like a party where you've earlier had, or the company of your friends, or even just the smell of alcohol, let's say, or the memory of good times earlier. So, someone, for example, recovering from opioid use might walk past a pharmacy and feel their whole body sort of tense up, even if they haven't used in months or sometimes even years. And after craving is sometimes, unfortunately, substance use becomes a coping tool, and many people don't use just to feel good, but it sort of becomes their way of avoiding feeling bad. And substances can temporarily soothe anxiety, depression, trauma, or loneliness. But the relief is very short lived, and over time, the substance stops working. And often, rather, it makes the mood worse and it makes the underlying issues, the emotional issues, worse. And life sort of starts revolving around the substance, where people with dependence would often start to miss other important appointments, be it with their loved ones. They'd prioritize getting and using the substance over everything else, work, family, hobbies, even their own health. And you might hear things like, I stopped seeing friends because I didn't want them to know about it, or how much I was drinking, or I was ashamed. So they'd rather choose not to meet their friends but to stop drinking, is what we would feel like. And I missed my kids school, some school play, because I was too sick from the withdrawal symptoms that I was having. This isn't just selfishness, it's the nature of addiction, and it's the nature of it taking over a person's focus and decision making. And there is sort of denial, and so which is incredibly common, where people, not because they're lying, but because their brain is protecting them from shame and fear. And they might say, I could stop if I really wanted to, or everyone drinks and it's common and it's not a big deal, or sometimes that it's not that bad. So denial is like a defense mechanism, and one reason early intervention is so tricky is because a lot of people are in denial in the initial parts of substance use. And from the outside, it may look like irresponsibility or selfishness. But on the inside, most people with substance dependence are struggling with a constant internal conflict, self judgment, and emotional pain. And the behavior is a symptom that this cause goes much deeper. So, how do we know if it's a probable disorder? What exactly are we supposed to do? So now you might be wondering, how do we actually know when someone's crossed the line from casual use to something more serious? Well, in psychiatry and psychology, we look at patterns of behaviors, how often someone is using, how it's affecting their life, how much control they really have over it. And there's a checklist we use. Nothing complicated, just some key signs that show up again and again and again when someone is struggling with a substance use disorder. Um, Let me break it down in simple terms. And there are about 11 of these signs. And if someone checks off, let's say, two or more of these within the past year or so, it could mean that they're dealing with a mild, moderate, or even severe form of dependence. Let's group these into three big areas. So first would be losing control over use, which is about how much and how often. So, are you using more than you meant to? Or have you tried to cut back out, but you just couldn't? Or are you spending a lot of time getting, using, or recovering from substance? Or maybe you're thinking about it or not, what we call, you're thinking about it a lot, which is called craving. That's your brain's way of saying that this thing has more control over me than I would like. And number two domain would be it's messing up with your life, and this is about the impact that substance is having. So is it affecting your work, school, relationships? Are you pulling away from friends or giving up hobbies that you used to love? Or are you still using even though it's causing problems in your life or with people that you care about? um, is your life, if your life is shrinking and the substance is taking up more space, then definitely that's a red flag. And number third is the signs of risky use and physical signs. Here we talk about safety and physical form of dependence. So, are you using in dangerous situations like while driving, or are you mixing substances? Are you continuing even though it is making your health or your mental health worse? Have you noticed you need more of this same substance to get the same effect, or you feel shaky, anxious, irritable when you stop, or and have like sleep disturbances? These last two would be tolerance and withdrawal, which are major signs that your body has gotten used to the substance and it is reacting to its absence. The more of these boxes one checks, the more serious the problem might be. But here's the key: you don't have to hit rock bottom to get help. Recognizing these signs early can make a huge difference in recovery. So here's what help treatment and recovery looks like. So recovery is absolutely possible. It's not always easy, but it's really a straight line. But with the right support and right people around, people do get better, rebuild their lives, and then even thrive. So let's break down what treatment and recovery can actually look like. Starting with medical support, for many substances, especially alcohol, opioids, benzodiazepines like Xanax, there's a physical side to withdrawal. So the first step might be detoxification or detox, which helps manage those symptoms and with a margin of safety. Then there is medication assisted treatment or MAT, which includes medicines like naltrexone or like acamprosate, methadone, or buprenorphine assisted treatments for opioid and um, alcohol addictions, and disulfiram for alcohol. And these aren't just replacements, they help balance first the brain chemistry, then reduce the cravings, and then lower the risk of a relapse. So they're especially helpful when combined with therapy and other interventions, which brings us to psychological support, where addiction doesn't, we know it doesn't happen in a vacuum. It's often tied to trauma, stress, anxiety, depression. And that's why therapy is a huge part of recovery. And some common types of therapy that is provided in case of substance use is cognitive behavioral therapy, motivational interviewing, where people are helped to recognize and change patterns to sort of that lead to substance use, or to assess their motivation, increase their motivation, explore their ambivalence towards substance, whether to leave or not to leave, and sort of build on that motivation to change. Then trauma informed therapy for those who substance use sort of is tied to their ways of coping with painful life situations. And therapy can often be one on one, but it can also be with in a group setting or even with family members. And peer support and community support is often the heart of long term recovery. So, groups like AAs, that's the Alcoholic Anonymous, Narcotic Anonymous, such services are also available in countries like India, where we- where there's like an accountability and connection, and it's a group effort to stay sober and thrive even if you've suffered with the substance use disorder. But what's important to know is that relapse can happen, because recovery isn't a straight line. People will slip, they will relapse. It's not failure, but it's part of the process. And what matters is always coming back and learning from it and reflecting why we went back to it, and sort of still staying connected with whoever it is that you're seeking help from. And recovery is about progress, but doesn't which doesn't mean perfection. And it's not about being cured, but it's about building a life where substance just isn't the center of it anymore. um, all right, so if you made this so far, thank you for sticking with me through a really important and extensive and often misunderstood topic. Let's quickly sort of recap what we have covered today. So we unpacked the difference between use, misuse, dependence, addiction. Then we talked about how addiction rewires the brain and why it is not just about willpower than what we usually feel. And we walked through the three-stage cycle of addiction and what it actually looks like in real life. Um, then we talked about the psychological signs, the diagnostic criteria, and what treatment and recovery can involve. And most importantly, we try to look at it in a comprehensive way and sort of At least I hope we sort of got an understanding of what substance abuse really is. So, substance abuse doesn't define someone's worth. It's not a moral failure, but it's a complex but treatable condition that affects real people: mothers, fathers, teenagers, professionals, artists, neighbors, maybe even you or someone you know or someone you love. So if you're listening to this and thinking and okay, this sounds familiar, please know that it's okay to ask for help. Um, we're not alone, and recovery is possible, and people do heal over time. This I hope this episode helped you in some way. I hope you share it with someone you think would benefit. You never know who might need to hear some of these things. And if you have any questions, feedback, or ideas, I'd love to hear from you. So you can reach me um, through any of the socials that I've mentioned in the description. Thank you for listening. Again, I'm Dr. Pavitra, and this has been great. This is Vriddhi Health. Take care and be kind of yourself and be kind to yourself.